So I'm going to talk a little bit more about special needs plans in particular, and talk about the final sort of subfile in the plan characteristics suite of files, and that relates to special needs plans. And after that, I'll sort of briefly kind of introduce you to two other files not associated with the plan characteristics suite of files. They're listed there. I'll talk about those briefly too. Yeah. So special needs plan types, there are three of them: chronic conditions, dual eligible, and institutional special needs plans. An abbreviated way to refer to them is C-SNP, D-SNP, and I-SNP. The majority of SNPs are dual eligible plans. This is a frequency distribution for SNPs from the 2021 plan characteristics base file, in which you can find a SNP type variable. So this distribution excluded all non-SNP SNPs. We're just looking at the SNPs, and you can see that there were 971 total SNP plans in 2021. Most of them were dual eligible SNPs. And as Gia, I think, mentioned in her last segment, the number of SNP plans has really increased over time, particularly in recent years. I mean, nearly almost doubling in the last 10 years. There are 1,156 in 2022. So let's just talk specifically about the D-SNPs for a moment, since they are kind of make up the bulk of those special needs plans. D-SNPs are a type of MA plan designed to meet the needs of dual eligible beneficiaries. So those members have both Medicare and Medicaid. The D-SNPs were authorized in the 2003 Medicare Modernization Act and began operating in 2006, were permanently authorized by the 2018 Bipartisan Budget Act. D-SNPs operate in 45 states and the District of Columbia, with about 3.8 million dual eligible bennies enrolled in 2022. A special type of D-SNP are FIDE SNPs. FIDE stands for Fully Integrated Dual Eligible Special Needs Plans. Medicare and Medicaid benefits are offered under a single managed care organization for FIDE SNPs, where they must cover primary, acute, and long-term services and supports, as well as behavioral health, unless the state carves that part out. These plans are eligible for payment adjustments for enrollee frailty. And so you're aware there is a way to identify FIDEs. There's a variable in the base plan characteristics file called FIDE_SNP. And so, yes, good to know that's there if you want to identify them. And in 2021, you can see that there were 66 of these FIDE plans that make up about 11% of all of the dual eligible SNPs. But they are growing, just like SNPs are. The number of SNP plans are growing overall. The FIDEs are growing as well. The number of the plans are growing. So sometimes we've been asked about HIDE SNPs. Those are sort of a slightly different flavor of SNP, similar to the FIDEs. It stands for Highly Integrated Dual Eligible Special Needs Plans. They first became available in 2021, so they're relatively new. Those must cover long-term services and supports or behavioral health. So slightly less, is required of them compared to FIDE SNPs. Unfortunately, we have not seen or noticed a way as of yet to identify HIDEs in the Part D RIF data. And that is, I looked in the RIF data through 2022, but hopefully one of these years there will be an indicator that will help us identify these plans in the future at some point. We'll see. Okay, so I just want to move on to the last of the plan characteristics subfiles that deal specifically with special needs plans. It is called the Special Needs Plan Contracts file. And this file, what it contains is, well, it lists all SNP plans, but it also provides some extra detail about C-SNPs and I-SNPs. The file became available starting in 2015, and it contains indicators for all of the condition categories that each C-SNP targets. Just so C-SNP stands for chronic conditions, special needs plans. So there are, an array of variables. There's indicators for different chronic conditions that, will tell you what that plan is targeting. So, right, for example, heart failure, diabetes. The special needs plan contracts file also contains a variable. Will give you kind of some more information about institutional SNPs. There's a variable called I-SNP type in there. So you link to this file using the contract ID and plan ID combo that we've talked about many times already today. Just a special note, fun fact, the SNPs are always MAPD plans. And so they always, cover Part D. Obviously, so we're talking about Part D today. The way the file is structured, there is one record per plan. And in 2021, there were 971 rows, therefore 971 SNP plans in that year. C-SNPs restrict enrollment to those with a severe or disabling chronic condition. In 2021, there were 203 C-SNPs. The most common condition categories that these plan covers in 2021 are listed there. Moving on to I-SNPs. I-SNPs are plans that restrict enrollment to those needing institutional level services. Some of these plans are for members actually living in institutions, but some are called institutional equivalent plans, and their members still live in the community, but require institutional level care. And in 2021, there are 172 of these plans. Here's a pie chart showing the proportion of the different types of I-SNPs. You can see most are institutional only plans. That's in blue. Some plans contain both types of members. The ones it's labeled institutional and institutional equivalent. So I interpret that to mean that they have members. Some of the members in these plans live in institutions and some still live in the community. The smallest category of plan is those that are purely institutional equivalent plans. Okay, so now we're getting out of the plan characteristics suite of files. We're moving on to two new, totally separate files. We want you to be aware of them. First is the medication therapy management file. The medication therapy management file, or MTM file. Each Part D sponsor is required to incorporate a medication therapy management program into their plan's benefit structure. Every year, sponsors must submit an MTM program description to CMS for review and approval. In 2021, in the 2021 MTM file, there are 752 distinct Part D contract IDs. The vast majority are MAPE plans. CMS requires that plans target beneficiaries for medication therapy management if they have multiple chronic diseases. Nearly 90% of plans target those, they choose to target those with at least 3 conditions. The members must also be taking multiple Part D drugs, and their Part D costs must likely to exceed a predetermined amount. In 2021, it was over $4,300. Plans have some flexibility in administering their medication therapy management plan. They can expand eligibility to those who do not meet the CMS requirements listed above, but they must enroll members using an opt-out only method. So what that means is each year sponsors must auto-enroll the target bennies who meet the eligibility criteria unless the beneficiary declines enrollment. MTM required services include interventions for both bennies and their prescribers, annual comprehensive medication reviews or CMRs, targeted medication reviews or TMRs, and the provision of information about the safe disposal of prescription drugs that are controlled substances. Beneficiaries enrolled in the MTM program may refuse or decline individual services without having to disenroll from the program. For example, if an enrolled Benny declines the annual CMR, the sponsor is still required to offer interventions to the prescriber and still required to perform TMRs at least quarterly, and also still required to provide the safe disposal information. Plans can offer value-added services in their programs. Some plans offer value adds such as referrals, such as referrals to case management, disease management, or specialty management. Another value add are newsletters, refill reminders, and medication guides. The MTM file is at the Benny level. It includes the date the Benny became eligible for the program, records MTM services and dates of service, whether or not the Benny opted out of MTM, whether the Benny had a cognitive impairment or long-term care status. Those are some of the variables included in the file. CMS creates the file using information submitted by Part D plans, and the file is available starting in 2013. Here's a depiction of selected fields from the MTM. This is not real data. Just kind of wanted to give you a visual sort of a sense of what some of the fields look like. So, you see the Benny ID, the contract ID, and, indicator variables look like that. Typically have a Y, means that, yes, they did meet the target criteria, or yes, there was a CMR offered. You'll often see dates. These are dates of these events, when they were enrolled, when they opted out. Yeah, kind of gives you a nice little sort of visual of the data. Sometimes it's just easier when you see it to understand it. So in the 2021 MTM file, looking at the actual file, I counted 3.4 million bennies, all of whom were enrolled in MTM at some point during the year. In 2021, almost 15% of them, however, opted out of the program. So they were automatically enrolled based on some of the criteria that I described earlier. They must have had at least, maybe 2 or 3 chronic disabling conditions and were taking multiple medications. There are a few other requirements too. Expected to spend a minimum of over $4,700 or something like that year, but they 15% opted out. So let's see here. Last note, enrollment, however, does not imply. So even if they didn't opt out and they stayed enrolled, it does not, you can't assume that they received all of the services that were offered. You can find out if someone, for example, actually received a CMR, the medication review. By using the MTM file, you can find out if an individual actually received it, and definitely if they were offered it. But you can't assume that they received it if they were offered the CMR. But you can use the file to find out. Okay, so the last file I'll talk about is the plan election type beneficiary summary file. So what is this file? This file captures enrollment data and includes information on how the member was enrolled. For example, were they automatically enrolled, or was it facilitated in some way, their enrollment, or was it through a point of sale enrollment, which is probably doesn't happen very often, but sometimes a pharmacy can enroll beneficiaries in a temporary plan. This file kind of, can tell you how the person ended up in the plan that they have. It also contains information on the low income subsidy for the Benny, and as well as a beneficiary self-selector indicator. That means, did the Benny choose the plan they're in? And also includes our favorite linking variables like Benny ID and the Part D contract and plan IDs. So the file is actually broken up into 2 separate subfiles, kind of like similar to the plan characteristics suite of files. There are 2 subfiles. One's called the plan election file, and the second is the reassignment file. So in both files, there's at least 1 record for every Benny enrolled in Part D during the year. In the I think it's the plan election file, there may be multiple rows per Benny if they had more than 1 plan during the year. So typical uses of these 2 files involve research that study the effects of Part D auto assignment and reassignment policies related to those with a low income subsidy. So that's kind of the primary, typical use for these files. Maybe why they're created was largely driven by those who wanted to study auto assignment or reassignment policies. Looking at the 2021 file, there were 3.3 million enrollees who were automatically assigned or reassigned to a plan. That's about 6.4% of the entire Part D enrollee population. So yes, there's a fair amount of people that are ending up in plans based on these auto assignment and reassignment mechanisms.